I wanted to provide a preview of some specimens that we're going to have in lab for you to handle. Try to be gentle with the nerves and vessels, but hopefully you'll have a chance to have some hands-on with these specimens. This brain is still in the calvarium, which is the skull cap. So the top half of the skull is present. This is often the way the skull is opened through a circular cut like this. You can see a frontal sinus within the bone of the skull here. And the skull has some periosteum on the outside, which is this outer covering right on the surface of the bone. And the internal periosteum is formed by the dura. So the dura has two layers, a periosteal layer, which is this layer, and then a meningeal layer, which is the layer that faces the brain. In this specimen, the dura is tightly adherent to the inside of the skull and not so much on the surface of the brain, but it is present still here between the cerebrum and the cerebellum. So this is the tentorium cerebelli between those two structures. Sort of came out a little bit here. Here's where the dura is open as one of the sinuses where the blood flows towards the jugular foramen. Here's the backmost region of the superior sagittal sinus. So then they all converge behind the cerebellum here. On the outside surface of the skull, you can see some attachment point for the temporalis muscle on the side of the head, one of our major chewing muscles. So that's got a big attachment point here. And in the far back, you can even see a little scalp. So here's some scalp with some subcutaneous fat above the periosteum. You might be wondering where the arachnoid is. Well, it's over all the surface of the brain here, going from gyrus to gyrus, spanning across the sulci. So here's the arachnoid here, just this thin fibrous layer on the top surface of the brain. See that? Let's take a look at the cranial nerves in this brain. So the olfactory nerve would be the small fibers going into the nasal passages, so that would be torn off. That would still be with the skull. But you can see the olfactory bulb and the olfactory tract, at least on the right side here. On the left, it was sort of torn off in the middle of the tract. But these are pretty small. In humans, we don't have a very strong sense of smell. So that's olfactory, going into the olfactory bulbs. Optic are these very large nerves here with the optic chiasm in the middle, forming that sort of cross pattern. I'm moving the internal carotid out of the way so you can see that. And then the third is the ocular motor. I'm not seeing it in this specimen. It would normally exit right here between the posterior cerebral artery and the superior cerebellar artery, so right down in here, but I'm not seeing it coming out. So the trochlear nerve, the fourth, the trochlear nerve exits from the dorsal surface of the brainstem, so it is unique in that regard. So it would be likely this. Actually, that's a blood vessel branch, so it's this. This is a little tiny trochlear nerve going to the superior oblique muscle, one small eye muscle. So that's the fourth nerve. The fifth, for the fifth nerve, you might have stumps remaining just on the lateral side of the pons on both sides. So here's a nice big one here. And here it is on the right. So that's the trigeminal nerve. The sixth nerve, the abducens, would be leaving right about here on the pons, almost towards the medulla. And I'm not seeing it clearly here. I have another specimen where that's much more clear, where you have abducent fibers coming out right here, just on the inferior margin of the pons. So that's it on both sides. And here's the stump of the fifth in this brain right here. The seventh and eighth nerves exit the lateral edge of the pons, just between it and the cerebellum, and you can see these three nerve bundles together right here. So the seventh would probably be the most superior one of these, and the eighth is vestibular and acoustic, which would be these more inferior two branches. And so on this brain, that's likely these branches here. So that's 7th and 8th, facial and vestibular acoustic. 9 and 10 are a bunch of smaller branches and they exit together in the lateral medulla. So that's these branches here on both sides. So all these branches of 9 and 10. 11 would be torn off most likely. So that's the spinal accessory. 12 are a bunch of little rootlets coming off just lateral to the pyramids on the ventral surface of the medulla. So that's these little rootlets coming out here. And they join together and form a single nerve going through the hypoglossal canal. So on this brain, that would be all of these rootlets here, which would come together and form the hypoglossal nerve.